could join us for today's event around the Lost in Translation campaign. I'm happy to see that a few legislators were able to join us, plus many members of our community, people from the State Department of Education, Aging and Disability Services Commissioner is here. I'm so happy to see you all with us. My name is Jeff Braven. I'm Executive Director here at the American School for the Deaf. This campaign has been a work in progress for almost a year. We started this, and I want to thank the state of Connecticut, who saw that these were issues that we were facing in terms of accessibility for deaf, hard of hearing, and deafblind individuals, particularly during COVID-19. And I want to thank the federal government for allocating ARPA funds to the state, and thank you to the state of Connecticut for allocating those funds to the American School for the Deaf so that we could collaborate with various organizations that I'll be sharing later to talk about how we can improve access, particularly in healthcare and educational settings. We started working with Innovy Strategies, a deaf-owned company who did a needs assessment of our community, and they saw clear evidence of instances where there was not equal access to communication. And so we want to raise awareness to help increase equity for our community. That work led to the decision to do a campaign to raise awareness around these very serious issues. Now I want you to imagine what it must feel like to be transported to a hospital by ambulance and not know what the paramedics are saying, the people around you. You're completely lost in a world of silence. Or if you were in a bed in an emergency room with no family members, but surrounded by doctors, nurses, medical professionals that are having frenzied conversations and you have no idea what's being said, it's extremely isolating. Isolated from the people that are trying to help take care of you. The breakdown in communication, the barriers are evident in these situations. You are surrounded by strangers. There's no way to understand or communicate your feelings or your needs. That breakdown in communication can lead to death. Now, as we switch gears, we see so many parallels in education settings. If you're in a classroom and you don't know what conversations are happening around you, you're not able to access the teacher or access your peers because you're not able to hear all the conversations that are happening around you, even though those people may care about you, for a student not being able to connect to their teacher or peers, that ultimately could lead to them failing their classes, or even after school, being able to be successful in life. And I use myself as an example. I was born deaf to a deaf family, and so from birth, I had immediate access to communication. However, my parents still decided to send me to a deaf school because I would have further access to deaf language and communication, and would be able to build on those strong foundations for communication and go into public schools later on. Later on, I was able to go to a public school, but it was a fight. I was finally able to get interpreting services and have access to all the communications that were happening in the classroom around me. Plus, I was able to get a dedicated note taker to take notes for me. But in terms of access to communicating and making relationships with peers, it was so limited because of coming back again to the theme of communication. And I really want to raise awareness for all of our deaf, hard of hearing, and deaf-blind students. We oftentimes see them here in Connecticut isolated. They should not be isolated. They should be included. We want to make sure that they are on a level playing field with all their peers. And so that helped us as we identified the name of this campaign, Lost in Translation. Today, it is all about moving from isolation to inclusion, moving to a place of equity. And I want to thank the Aging and Disability Services Commission for allocating those grant funds to us today. And we can see all of the organizations working hand in hand with us. We see Communication Access Network, Connecticut Association for the Deaf, Hear Hartford. And today we are launching a public service announcement that we will be showing you soon. We'll also be launching a social media campaign. Additionally, we will begin an interpreting pilot program that will be starting in March and running until June, where we will be providing free interpreters for all hospitals throughout the state of Connecticut from 5 p.m. until midnight, 7 days a week, in order to be able to gather data from all of the hospitals around deaf, hard of hearing, deaf-blind communication needs. We are also working hand in hand with the Connecticut Hospital Association to work on various professional development videos and materials to be able to train healthcare professionals throughout the state of Connecticut to make sure they are providing appropriate, accurate, and safe communication and information to our deaf, hard of hearing, and deaf-blind community members. Everyone in our community, whether they are deaf, hard of hearing, or deaf-blind, deserves to understand what is happening around them in a healthcare environment, whether they're in an ambulance, emergency room, or urgent care center. And I want every hospital to pledge that they will be dedicated to providing full equity and communication access to every member of our community. In educational settings, we know that Connecticut is one of just a few states that have passed a law about a language and communication plan. The language and communication plan is required to be discussed during individual education planning meetings or 504 meetings here in Connecticut. I want all school districts and every special education director to commit to discussing the language and communication plan for every child during their PPT or 504 meetings to make sure they have full access to language and communication in the classroom, whether it be here at the American School for the Deaf or in a mainstream program. We want them to have full access and equity in the classroom. And we're going to continue to work with state government officials, educational institutions, and healthcare settings to remove the barriers around communication access. During this very critical moment in their lives, it is imperative. And so we must reach out and educate everyone. And we need to make sure that everybody has an understanding and has a respect for the importance of being able to connect and to communicate. And so this is a movement we are launching today to assure that all deaf, hard of hearing, and deaf-blind individuals here in the state of Connecticut will never feel lost in translation. With that being said, I would like to invite Louisa Sobolewski, the president of the Connecticut Association for the Deaf, to share some remarks.
Thank you, Jeff. It is nice to see everyone in attendance today. My name is Louisa Sobolewski. I'm the president of the Connecticut Association for the Deaf, and I also co-chair the state board or council for the deaf, deaf-blind, and hard of hearing folks in Connecticut. And I am happy to join you all today. Between Jeff and myself, my committee through the Connecticut Association for the Deaf, the boards we work on, we're working together and have been doing so for some time to get to this point. I am third generation deaf, born to a deaf family. I have deaf children, 4 grandchildren, 3 of which are deaf, and I have 1 coda grandchild, a child of a deaf adult. So access in my family to communication is not a problem. I am from Philadelphia, Pennsylvania, attended school there, public school, and after 4th grade, I had to sit in the front of my class and missed a lot because I did not have an interpreter. But when I went home, I had access to my family, deaf family. My parents brought me to different organizations, so I had that experience, that rich experience growing up. And then I moved here to Connecticut because I got a job here at ASD as a teacher, and I'm really proud to have taught here. Back then, when I first moved here, the services were top-notch in Connecticut. Connecticut was one of the first states in the country to establish services for the deaf. It was called the Commission for the Deaf and Hearing Impaired back in the 70s. It was wonderful. They had the best services. There were none of these barriers we talk about today. Now we have various technology, texting, phones, and I've had 2 children, both of which were born in Hartford Hospital in '84 and '87, and I had access to interpreters all day. We had services at all times for 2 interpreters, and I was amazed. I was a different person when I could understand everything that was going on. In 1984, the Olympics were happening in Los Angeles. Babies were being born, and I felt included. I was amazed that I had access to all the information. It was great. And everything was interpreted. I was involved with CDHI, and then they became DOORS, and funding was cut at some point, and I am not going to blame anyone, but it became frustrating, and I've retired as principal here and decided to roll up my sleeves and get involved and became president of CAD. I wanted to improve the services in the state of Connecticut, and right now I'm getting phone calls from deaf folks in Connecticut, deaf, blind. They're having these issues with communication access, not having interpreters for their appointments, limited interpreters, or interpreters do show up and they have to leave before appointments are finished. There's numerous problems happening every day. I had full access, as I mentioned, when I gave birth to my children, but times have changed. I have a friend who recently gave birth in Western Connecticut in a hospital and had no interpreter during their stay at the hospital. There's a huge shift in services between what I experienced in the 70s when I had my children versus now. And we're particularly talking about medical. There are no interpreters out there, and deaf people are seeing the barriers get worse rather than better. And with ARPA funds, we want to help deaf folks become their own self-advocates. And hospitals will respond to me saying that they don't see these problems that deaf folks are complaining about. And I have to explain again and again that 90% of deaf children are born to families who can hear, hearing families, while only 10% of deaf children are born to deaf families. And out of that 10%, those folks have access right away from the time that they're born. The minute they're born, their parents are communicating with their babies. But that 90% I speak of who are born to hearing families, they have to figure out what they're going to do with their deaf babies. These children, that 90%, are experiencing language deprivation. It's a problem in education, the medical field, and we want to improve the system so that all children, regardless of which families they're born to, and no matter their age, have access to communication. And I am not here to blame anyone or point fingers. I'm here because I want to be part of the process in improving this system. Oftentimes, people will say you have to be deaf to understand. And that makes me think. I'm not blind. I can't experience or understand the experience a blind person goes through. And I respect people who are blind. I do my best to try to communicate with them and not necessarily advocate for them, but help them advocate for themselves. And it's the same with the deaf community. I'm teaching workshops, working with legislators, setting up legislative breakfasts to better educate our community, our deaf community, deaf, blind, here in Connecticut. With ARPA's support, things are happening. 2024 is about time these things are going to happen. So thank you, everyone.
Thank you so much, Louisa, for those wonderful remarks. Next, I would like to invite your Commissioner for the State of Connecticut, Aging and Disability Services, Amy Porter. She's been a wonderful collaborator with our community. Amy?
Thank you so much, Jeff, and thank you for inviting me here today. This is a great launch today. At Aging and Disability Services, we're excited to be a part of this. We're excited to partner with ASD. We're excited to partner with our advisory board for persons who are deaf, hard of hearing, and deaf-blind. We're committed to serving as a resource for individuals with disabilities and older adults here in Connecticut. And during COVID, as you just listened to some of the stories, during COVID, we experienced a lot of things, all of us, that we never had before. But for the deaf community, the issues that were out there were just amplified. There were issues already, things starting to, as Louisa talked about, struggles being able to get access. But during COVID, we really saw those issues come together. So I know that our administration and the legislature are particularly interested in figuring out what we can do differently. I know that our agency is particularly interested in what we can do differently. So being able to use the resources, leverage the resources from the ARPA dollars, and partner with folks who are living this experience has been really critical for us. When Jeff came to ask, Jeff and Barbara Casson came to ask, you know, could we do something? Could we put a proposal together with the ARPA dollars to first really find out what the experiences are out there? Because we know, but we don't have any data. So can we use the ARPA dollars to really do a needs assessment, do some focus groups, do some surveys? And so they were able to collect some data. And with that, they were able to come up with this robust set of strategies that you heard Jeff talk a little bit about to tackle some of the issues that Louisa just outlined for you. When we talk about access in medical settings, to be able to provide interpreters and actually collect data for what is needed in an emergency room, in a medical setting, in the evening at hours we know are a struggle to be able to get access. So having real-time data to then be able to inform us moving forward with policies, with strategies, with solutions, this community has come together. In the past, if you look around, probably half of the room are folks who have volunteered their time to try to make a difference for this community. And now we have some funding that we can actually put forward to support all of that effort, really advance that effort, and help folks have that aha moment. I've seen a few of the aha moments. Louisa was talking about maybe you have to be deaf to understand, but I've seen people as they reach the aha moment with, oh, I never thought about that. And there's more and more of the aha moments, but this campaign can make a huge difference. Get the word out, really help people understand what some of the challenges are there, and hopefully collectively we can partner together to continue to address them. So thank you for inviting me. Thank you for all the work that you've done with the folks here, and I'm excited to be a part of it.
Thank you so much. Amy Porter, for your continued commitment and dedication to our community. Amy and I recently met, and we are looking for increased funding to be able to support our deafblind community members, so I'm very excited about the potential and the capacity to be able to support that community. Next, we have another wonderful collaborator from the state, Brian Kilmkowitz from the State Department of Education. He is the Director of Special Education and a wonderful friend and colleague for our school.
Good morning, everyone. I am very honored to be here on behalf of the Connecticut State Department of Education this morning. I have a humbling role at the state as the Director of Special Education, which is an awesome responsibility, and so appreciative to work in the great state of Connecticut, where we have such amazing collaboration and partnerships with our agencies and our programs. And on behalf of Commissioner Russell Tucker and our Deputy Commissioners Sone Moyano and Hughes, I would just like to extend our appreciation and for the work that's happening here at the American School for the Deaf under the leadership of Executive Director Braven and Assistant Superintendent Paula Moravito, and of course the amazing administrators and staff that make all of the magic happen here in this program. This school certainly has a rich tradition and experience for students and is a national leader providing comprehensive services for students who are deaf and hard of hearing. And I really appreciate all of the work that happens here on a daily basis. I would also like to congratulate the American School for the Deaf for their work on this initiative, really bringing to light significant issues across the state of Connecticut, which focus around a lack of awareness, a lack of understanding, and a lack of resources in a variety of settings. At the State Department of Education, we're really committed to each and every student having the same opportunities for success in life, and that's made possible through access and equitable access to education and communication. And that's very critical and serves as a foundation for all of our students, because students' learning is significantly impacted when there is lack of access to communication. But with the proper supports and services and tools, we know those students can and will be successful and make those important connections with their teachers and support staff and families. Through this Lost in Translation campaign, the American School for the Deaf is working to educate the public about the importance of strong communication access. And you've heard and seen the partners that the school is working with, and we're very excited to continue to partner with the American School for the Deaf to play a role in that world of education for our students and families. Executive Director Braven talked a little bit about the language and communication plan, that legislation and process that we are very proud of, where each and every planning and placement team in the special education process and Section 504 team in that process for access discuss those needs for students around communication, assistive technology needs, and even discuss situations in school which result in emergency situations. Having that in place is great, but we know there's a lot more work to do so that those plans are not done in isolation or as an afterthought, but really collaboratively within the team to drive those plans and programs. So we look forward to working with you all to ensure that all of our school districts are trained and understand the importance of those plans in schools. And we're also excited to work with families and students to ensure that they're meaningfully participating in the process. And that's a federal responsibility that we have, but also a responsibility where we know that the investment in resources for interpreters and access to and communication will lead to increased results and achievement for students. We have an ongoing commitment and collaboration with the program here, and we're excited to continue the partnership. Together, we want to ensure each and every student has full access to language in the classroom and their preferred communication approach, and we're looking forward to working together to ensure no students are lost in translation. Thank you very much.
Brian said it so well, and Brian has been an amazing friend to the school, a tremendous advocate. When we see situations happening, I know I can always reach out to Brian, and he is always there to answer questions and advocate for every child, so we really appreciate your work at the state. Thank you, Brian. Next, another wonderful individual who's been working very closely with us in the work we've been doing and will continue to do so, particularly with the interpreter pilot program, the Connecticut Hospital Association. I'm so glad to welcome Muriel Daniels from CHA to come share some remarks with all of you today. Muriel?
Good morning, everyone. And as Jeff said, my name is Muriel Daniels. I'm the Director of Regulatory Advocacy for the Connecticut Hospital Association. And I've actually been doing work on behalf of the association and the deaf community for almost 16 years now. And I met Lisa back then, and I've been reunited with her recently. And since 2022, CHA has worked in partnership with the American School for the Deaf, connecting them with our hospitals and focusing in on how to improve communication access for the deaf, deafblind, and hard of hearing individuals throughout Connecticut. We, ASD, actually provided important feedback and information to our hospitals based on the results from the statewide community needs assessment that they provided and conducted. And CHA is so grateful to ASD for their commitment to not only raise awareness, but to establish initiatives that will benefit patients, providers, and the community alike. The hospitals are eager for the upcoming rollout of the interpreting pilot program and for the training videos that have been developed in consultation with their peers, but also with feedback from the hospitals. And we're also excited for some of the other work they have planned around helping interpreters get trained and prepared to work in medical settings. And we are appreciative of the assistance ASD has provided in helping hospitals obtain clear masks for use with individuals who rely on lip reading to help communicate. We are confident, both CHA and the hospitals, that through continued partnerships with stakeholders like ASD and so many other of you in the room today, that we will continue to break down barriers and really be able to provide access to communication that is both effective and meaningful for the deaf-blind, and hard of hearing individuals who we serve. We are so thankful for everyone here today in support of this, and especially to ASD and all those involved who are going to help move these initiatives forward. Thank you so much.
Thank you. The hospital system is quite complex, as many of you may know, and it's so broad that it can be difficult to find an entry point. So I want to thank the CHA for helping us connect with different programs across the state. So thank you. Finally, I'd like to welcome John Rubin, ASD Board President, to the stage. He has been a tremendous advocate for our school, for our children here in the state of Connecticut, and for our community as well. So John, it's my pleasure to invite you to the stage.
Good morning, everyone. On behalf of American School for the Deaf's Board of Directors, I wanted to welcome all of you as friends here on this very proud day, both for American School for the Deaf and for the state of Connecticut. No one in the deaf, hard of hearing, and deafblind communities should feel invisible, although sadly that's too often the case. Since 1990, governments, businesses, and nonprofit organizations are required under the Americans with Disabilities Act to provide access to people who are deaf, hard of hearing, and deafblind in a way that matches how they communicate. Yet too often this promise is not fulfilled. Now, the American School for the Deaf, working with colleagues in healthcare and educational leadership, is ensuring that the rights of those with hearing loss are always ensured and protected. Today, we're very excited to announce the launch of our Lost in Translation public education campaign to raise awareness of the issues as we work together to make lasting change. We're inviting community leaders across Connecticut in the educational and healthcare systems, many of whom are here today, to come together to recognize this problem and make a commitment to improve communication access for deaf, hard of hearing, and deafblind students and patients. Through this project, we're providing professional development training materials to Connecticut's hospitals and healthcare systems to better prepare their teams to interact with and provide care for patients with hearing loss. We're also embarking on a 3-month interpreting pilot through which in-person interpreting services will be provided to participating hospitals during the hours of 5 p.m. until midnight from March 1st to May 31st. Through this effort, we look forward to demonstrating best practice for communicating with deaf patients and raising the bar for the future. We'll also provide clear masks to interested hospitals to improve access among patients who rely on lip reading to communicate. Now, over the next several months, we'll collaborate with our educational leaders to ensure that the right tools are in place to help students with hearing loss thrive in the classroom and become their own best advocates as they graduate from high school and move on to their next path, whether that be in college or in the workforce. Thank you to all of you, friends who have joined us today in solidarity to improve communication and access for our deaf, hard of hearing, and deafblind communities. I'm especially grateful to our partners in this work, the Connecticut Association for the Deaf, Hear Hear Hartford, Communication Advocacy Network, the Office of Aging and Disability Services, Connecticut Hospital Association, the State Department of Education, and our state's elected officials. Thank you all for all you do to ensure that not another person is lost in translation. Thank you.
Thank you, John. Thank you so much for continuing to be an advocate for our community. As Amy shared, with knowledge and resources together, we can do so much more. And I want to thank our partners, Adams and Knight, as well as Sullivan and Lashane, for their continued support around the marketing and PR efforts for this campaign. And it doesn't stop today, it's going to continue going forward. Now I'd like to show you a video that we just produced with our wonderful actor who's here with us this morning, Justin Brooks. Enjoy. There was no sound in the video for obvious reasons. You may have seen the patient signing help. This is the sign for help. And did the medical professionals understand that? No, there was no interpreter present. what an impact. That is an experience that happens to our community on a daily basis, and we have to put an end to this. There will be other materials that we'll be sharing with you. Thank you all again for joining us today. The intent of this campaign is to raise awareness to make sure every child, every adult, every person who is deaf, hard of hearing, or deafblind does not remain lost in translation, but rather is provided with equitable, appropriate access. Together, we can make a difference. Thank you all again for coming and helping us continue this effort.